So, what's cooking good looking? Today we are discussing about COVID. So, Caffeine Surge is starting new section as in COVID tales. So, we have Dr. Sonali Inamdar with us. So, she will join she is here to join. And we are going to discuss about cardiac manifestations in COVID. So just wait her to join. Yes. Okay. So she's joining with us. Yeah, doctor is here. So welcome, doctor. How are
Hi,
you?
thanks. Thanks for inviting me.
Yes. So as I just introduced to the audience, we are talking about the COVID manifestation, cardiac manifestation especially. So, what
Okay.
are the cardiac things in can happen in COVID patient?
Okay. So, COVID, even though it's primarily thought to be a lung disease, it does not spare any other organs because it causes a lot of widespread inflammation. So, around 20% of patients, unfortunately, do come to the hospitals with primarily cardiac manifestations. And even those who are not primarily presenting as cardiac manifestations do tend to have certain signs and symptoms of cardiac affection. So, it affects a whole host of systems in the cardiovascular system. It affects the coronary arteries, which are the arteries that supply the heart. It affects the heart muscle. It also affects the electrical system of the heart, because of which there is arrhythmias which arise from it. Also, the covering of the heart, which is known as the pericardium, there is inflammation in it, and it leads to effusions, that is fluid collection around the heart.
Mhm.
And more commonly, there are a lot of clotting phenomenon, clotting mechanisms which get recruited in the body. And there are a lot of widespread clots that happen both in the arteries and the veins. And more significantly, it causes clotting in the coronary arteries and in the arteries that supply the lungs.
Okay, so
Yeah.
all this can happen. It's like on a TV.
Yes.
Everything is possible.
Yes. Everything is possible. Yes.
So, what are the acute manifestations? What can happen immediately?
Right. So acutely, COVID can manifest exactly like a typical heart attack that patients get, wherein they get excruciating chest pain, sweating, nausea, vomiting, and many patients, because of the fear of the pandemic, tend to not report to the hospital, and that is catastrophic for a few. Uh, it presents basically as a normal myocardial infarction, either as a ST elevation myocardial infarction or a non-ST elevation myocardial infarction. And invariably, these patients, if they're too sick and if warranted, we tend to take them in the cath labs, and we discover that they tend to have a lot of clots within their coronary arteries, which needs to be removed. Surprisingly, a few patients tend to have normal coronary arteries also, in which the mechanisms for such chest pain or for such ECG manifestations or blood manifestations of heart attacks is different. As I mentioned, there is widespread inflammation because of COVID. And also, when the lungs are affected in COVID, there is a lot of hypoxia, that is, the oxygen saturation in the blood is decreased. So all of these effects tend to cause an oxygen mismatch in the heart muscle, and the demand and supply of the coronary blood flow is affected, and that leads to manifestations of heart attack. But in the cath lab, their coronary arteries tend to be near normal.
Okay, so this means
Yeah.
the chest pain might be originated from the heart or might be originated from the adjacent tissues like lung. So, but one should not
Yes.
ignore these kind of signal, signs and symptoms.
Absolutely, because you will not know unless you cath a patient and find out what is the cause. Since COVID is a systemic disease, you cannot take anything for granted. You cannot say, oh, it's just a lung problem. If there are cardiac manifestations, they need to be addressed.
Yeah. What will be the long-term manifestation, long-term effect of the COVID?
Right. So, COVID usually lasts for 2 to 4 weeks, depending on how severe the COVID has been in a particular person. But there is a new entity which is known as long COVID or long haul COVID, in which even though the infection is cleared away, the inflammation remains for a long time, and the symptoms of COVID remains for a long time. Of course, the manifestations are in various organ systems, but the cardiac manifestations, which are of my concern, of course, are that they remain after 3 months. That is 12 weeks after a patient has had COVID, and they are in the form of palpitations or arrhythmias, and they can be pretty distressing to a patient. For example, somebody who is pretty normal in a sitting position suddenly stands up and the patient has palpitations and tachycardia. This is something known as the postural orthostatic tachycardia syndrome. So all of these things have to be considered, especially in cases of people who've had COVID in the past. Of course, it doesn't matter whether somebody's had a mild COVID or a severe COVID. Invariably, long haul COVID can affect either of the two groups. So it doesn't really differentiate between the two.
Okay. So how to deal with it?
Right. So dealing with long haul COVID is basically, first you've got to be aware that certain symptoms of the COVID inflammation does tend to persist. And especially when you're trying to get back to your normal life after you have recovered from COVID, especially when you're trying to get back to an exercise routine or a pre-COVID, strenuous lifestyle, it is always better to get your heart checked out. If you have symptoms, all the more reason to do so. But I would advise, even if you are asymptomatic, I would advise to get a basic electrocardiogram and an echocardiogram in order to understand what is the manifestation, the silent manifestation of COVID on the heart muscle. We do not want surprises, especially in healthy individuals who've recovered from COVID, and we do not want them to, face an ugly surprise when they exercise and then they have these distressing palpitations. So we're still in the learning phase when it comes to COVID. It's a work in progress. So always better to be safe than sorry.
So when one should get this ECG done after the recovering from the COVID?
So I would advise, if there are symptoms, get it as soon as possible. Otherwise, 3 months after you've recovered from COVID, just get a basic baseline ECG and echo done. Make sure your heart muscle is fine. Make sure that, silently the inflammation has not affected the heart muscle. The pericardium is fine. It's not caused any affection of the electrical system. So if it's all good, then you can go ahead back to, slowly getting back to normal.
So it's always better to get oneself checked at specific interval and take care of oneself, right?
Yes, absolutely. Absolutely.
And many times this question arises with the athletes also. They want to go back to their routine, and then
Absolutely.
they want exactly. So
all the more reason for athletes. Absolutely, yes.
Exactly. Sachin Suryavanshi is saying good morning, madam, to you. So please say good morning.
Hi, Dr. Sachin. Hi.
Okay. So thank you, Dr. Sonali, for joining with us and giving such a valuable information. So thank you so much. You're taking time out of your busy schedule, and thank you so much. Okay.
Thanks for having me. Thank you.
Okay.
Bye.
You can sign off. I'll save this video and I'll put it on.
Okay.
Bye.
Bye.
Take care.
Take care.